One.
This is my assessment of the knee. We have got consent from Niall, both written and verbal. Before we start the assessment, what we would do is observe to see if there's any leg length discrepancy. So we'll just check and have a look at the levels of the spine. I'm happy with that. We would then look to see if there's any quads wasting, whether there's any calf wasting, which appears to be on the left side. We would also look to see if there's anteverted or everted hips, and also to see if there's a valgus or varus deformity. We would look to see if there is any swelling in and around the knees, whether the feet are pronated or supinated. Now, can you turn sideways onto me, please? Doesn't matter which side. We would also look to see if there's any distortion in the Achilles, and look the other side as well, please, now. And also look at the arches, both left and right, to see if there's flat feet. Once I've carried out observation, I would then get the client onto the treatment table. I can be on the treatment table. And just lay it flat for me. And again, I'll just have a quick observation and just have a look to see how the hips fall. Once I'm happy with that, what we would then do is go on to palpate. And I would first palpate to see if there's any temperature change on both sides and compare. That's fine to eliminate any acute inflammatory process or a sepsis. Once I've carried out temperature check, I will just see if there's any inflammation on the knees by carrying out a patella tap. That's fine. If there was minimal swelling, and I suspected so, I would just carry out a sweep test. But that appears to be fine. Following that, I would go on to palpation, and I would start on the medial aspect of the joint line and see if there's any pain on the joint line itself. Any pain there at all? No. I'll just bring that into slight flexion and no pain on the lateral aspect. I would go in and palpate the femoral condyles. No pain there. No pain there. Okay. I would then go and palpate the soft tissue, putting my finger on sartorius and just wrapping around to see if sartorius is painful, but that seems to be fine. But also semimembranosus, coming into pes. Any pain or discomfort there? No problems. I would palpate to see if the medial collateral ligament is tender at all. Any pain there at all? No pain there. I would then go on to the expansion of the VMO. Any pain into there? That's fine. Whilst I'm on this aspect, I would also palpate to see if there is any presence of a plica, and also just palpate into the Hoffer's pads. That's fine. We would then just have a quick feel of his quads, just to look at if there's a difference in tightness on one side to the other, but that seems to be fine. I would then go into the top of the quads tendon and palpate across the top. Any pain there at all? No. Okay. I will then come into the inferior pole of the patella. Any pain there at all? No. And then into the patella tendon. Any pain there? No. Into the tibial tuberosity. Any problems there at all? No. That's fine. I will then move laterally and I will check the ITB band to see tightness and compare it to the other side. And they both feel normal at the moment. I will then look at the lateral collateral ligament, and that's fine. I would also palpate the attachment of the biceps on the back of the fibula. That seems to be fine. And also palpate the superior tib fib joint to make sure there's no issues there. And that seems to be fine. From this position, I will then check active range of movement. So now, can you just bend your knee up as far as you can? Okay, now just over pressure, just to see the end feel. That's fine, and I will compare that to the other side. I would also then look for extension. Okay, just by raising the leg up, and that's fine. I would just like to overpressure extension as well, just to see end feel, and that seems to be fine. I would then go on to muscle testing. Now, can you just bend both knees up? Okay, and what I'd like you to do is on your right side, pull towards your bottom. That's fine. And then left side, pull towards your bottom. That's fine. Both are equal. I would then go and check the quads. So what I'd like you to do is just straighten that leg out. Now, can you straighten the leg as hard as you can, going all the way up? That's fine. Now keep it there, don't let it push down. Any pain or discomfort there? No. Okay. And we'll just compare that to the other side. Okay, just push your leg up as far as you can. That's fine. Now keep it there, don't let it push down. That's fine. What I will do now is turn Niall over onto his tummy. So I'm going to turn you over onto your tummy, please, now. And again, I'll just carry out a quick observation to see if there's any swelling in the popliteal fossa, if there is a presence of a big cyst, but that seems to be fine. Before I palpate, I'll just make the client a bit more comfortable. And so I'll start my palpation on the lateral aspect of the affected joint, and I'm following the biceps into its attachment. That's fine, but I'll also feel to see if there's a flabella present. No flabella. I will just go into the back end of the joint and follow the joint line round to see if there's any pain there. There doesn't seem to be. I will just palpate the tendon of semimembranosus and follow it round. There's no issues there at all. But whilst I'm here as well, I will also just palpate between the two heads of the calf to make sure there isn't a DVT present. That's fine. And again, I will just palpate muscle bone of the hamstring to see if there's any tightening going on there. Whilst I've got him in this position, I just quickly like to clear the spine. And so I'll just palpate the spinous processes. Any pain there at all?
No.
Paying particular attention to the facet joints on L2, L3, L4, L5, S1, and make sure that they're fine. Once I've got him in this position, I would also do some testing, and the one that I would start off with is a dial test to make sure there isn't a posterior corner injury. So just twisting the feet at 30 degrees flexion. If there's a 10-degree discrepancy between the right side and the left side, that would suggest there is a positive dial test. And again, I would repeat at 90 degrees, and that's fine. Once I've got him in this position, I would also do the Apley's compression test for meniscus. And if it produces any pain on either of the compression and rotation movements, then that would be indicative of a meniscal lesion, although it has a low sensitivity. I will then distract and repeat to see if there's any ligamentary involvement, but that's fine. Can I now turn you back over onto your back, please? Now? Once I've carried out the test in prone, I would repeat some of the tests in supine, and the first one that I would start off with is to eliminate any ACL involvement, and I would carry out an anterior draw by giving a sharp thrust, and that's fine. And I would also check for PCL, and that's fine. However, you can always get a false positive if you have a sag sign, so I'll just have a look to make sure there isn't a sag sign suggestive of a PCL injury, and that's fine. We'll just straighten that out again. I will then do an anterior draw test, and this is more sensitive for both acute and chronic ACL injuries, but I'm quite fine with that. If you find that you can't do that test by holding, you can put something underneath the knee to support the femur whilst carrying out this test. I'm good with that. I will then look at the medial and lateral collateral ligaments and just put them on a stress. Any pain there at all? No. And I'll just do the lateral collateral, and that's fine. I will then look to do a McMurray's test or a more modified pivot to see if there's ACL or meniscal issue. Any pain there at all now?
No.
Okay, I'll just repeat that. Any pain at all?
No.
There, that's fine. hand placing should be, you should make sure that you don't compress the patella whilst carrying out those tests, as that can give you a false positive. I will then just do a patella apprehension test and a grind test, just to make sure there isn't any patellofemoral joint involvement. And one of the joints that's regularly missed in a test is the superior tib fib joint, and I will just go in finally and just check to make sure the superior tib fib joint is fine. I would also look at the joints above and below, so I'm just going to go in and have a look at the hip and just look at rotation, both internal and external, and perhaps just apply just a bit of a compressive force to see if there's any hip pathology going on. That's fine, and I would compare that to the affected side, unaffected side. I would look at the ITV band, and that's fine. What I need you to do now is lay on your side, so I'm just going to have a look at the femoral nerve to make sure there isn't femoral nerve involvement. Just bend both knees up. Okay. Can you just tuck your chin into your chest? I'm going to grab hold of your leg and I'm just going to pull it back to where you start feeling a bit of tightness at the front of your thigh. Okay, just about there.
Yeah.
Can you raise your head up? Okay, and I'm just going to continue that to the back to start getting any tightness. Any pain there at all?
No pain.
Okay, just bring your chin back to where it was. Does that cause you any pain?
No pain.
Okay, I may just increase flexion of the knee to eliminate any pathology, but that's fine, there's no nervous involvement. I will check that against the opposite side again. I'm just going to check for the strength in the glutes as well whilst I've got him in this position. Can you just open your knee up and just keep it there? Don't let me push down, don't let me push down, don't let me push down. Any pain or trouble there at all?
No.
No, that's fine. And I would compare that to the other side. I would then get the client standing up. Can I just have you standing up, please, now? And if I was concerned about the meniscus, can I just get you standing here? What I'd do is I'd carry out the Thales test. So just stand on one leg, okay, just on one leg. And what I want you to do is rotate 3 times with your knee slightly bent at 10 degrees and tell me if there's any pain there.
No pain.
Okay, can we repeat on the other side? Just 20 degrees and twist. Any pain there at all?
No pain.
So we've eliminated meniscal issues. We would now do some gentle functional testing. So from there, can you just squat down and stand back up? Any pain there at all?
No.
Okay, what I want to do is look at control of the hip now. And what I'd like you to do is just stand on your right leg and just repeat squatting, please. Just as far as you can go comfortably and back up. Just do 3 of those. And what I'm doing is I'm looking to make sure that it's got hip stability. Repeat on your left side, please. That's fine. Finish off by just having a look at Niall walking. So now can I just get you walking? Okay. That's fine. Can I just pop you back on there?
Yeah.
Right at the beginning we noticed that he had calf hot wasting, so I just want to measure that. So what I will do is find the joint line and look to measure 6 inches and then measure at that level. We've already pre-marked it, and here he's got 36 centimeters on the left, and on the right again we'll just identify the joint line, move down 6 inches and then again measure. Let me just measure that. And here we're 37.5 inches. So he's got 37.5 centimeters. So he's got 1.5 centimeters discrepancy between the left and the right. And just finally, just to finish off, I'll just quickly check to make sure there isn't a true leg length discrepancy, although that's 92 centimeters. And that's 92 centimeters. Let's have you standing up, please. And that concludes my assessment of the knee. I would then go on to do some provocative testing, but also if those were all negative, I would then go on to do some functional movement assessment tests, just to look at the kinetic chain and look at the control between the hip, the knee and the ankle. Thank you.